Raise your hand if you know someone who has cancer. Now raise your hand if you have lost someone to cancer. Despite great advances in our understanding of the causes of this disease and the development of treatments for it, current data from the Centers for Disease Control shows that cancer is still the second cause of death in the United States. Furthermore, according to the Surveillance, Epidemiology, and End Results program from the National Cancer Institute, a person has a 40% probability of developing cancer in their lifetime. What this means is that you or I have more or less a 1 in 2 chance of having cancer. What statistics also show is that cancer's incidence rates and death rates are influenced by your race and your ethnicity. A 2023 report from the American Cancer Society shows that African American men have a 70% higher incidence rate for prostate cancer than white men do. And African American women, despite having a slightly lower rate for breast cancers than white women do, when they are afflicted with this form of the disease, their death rates are 40% higher than those of white women. These differences are known as health disparities. In the next few moments, I would like to share with you how minority-serving institutions of higher education, such as historically Black colleges and universities, or HBCUs, can help reduce these disparities. Our students are uniquely positioned to engage with their communities, to raise their awareness and empower them so they become active participants in reducing their cancer burdens. First, I would like to talk about cancer treatments. Cancer treatments are most effective when they are tailored to the patient. In other words, one size does not fit all when it comes to cancer care. And a striking example of this was published in 2022 in one of the flagship journals of the American Medical Association, where they showed that even when access to care and treatment is equitable, African American men fighting prostate cancer have double the disease burden of white men who are also fighting this disease. So this personalized cancer treatment modalities, also known as precision oncology, are revolutionizing cancer care. And an essential component of developing these new treatments are clinical trials. Today, in the United States, clinical trials are rigorously executed to ensure patient safety, and participation in them is entirely voluntary. A 2021 review published in another journal of the American Medical Association analyzed diversity in the participants in clinical trials. And it demonstrated that for precision oncology trials for lung, breast, prostate, and colorectal cancers, 82% of the participants are non-Hispanic whites, and only about 10% are Black. This lack of diversity in clinical trials results in an incomplete picture of the new therapy's efficacy, side effects, and the best protocols for their administration, and it's especially disastrous for individuals of communities of color. Now, this lack of diversity in clinical trials is rooted in a lack of trust in biomedical research by communities of color. And this is grounded in the abuses these communities experience in recent history. An example of that is the Tuskegee syphilis experiment that went on for 40 years, ending in 1972. I believe that HBCUs can help diversify clinical trials. For example, as institutions, we can enter into partnerships with biomedical research centers that are engaged in these clinical trials, so that our students can receive training in clinical research and in how clinical trials are designed and executed, while at the same time they go to their communities and educate them about how clinical trials are made and why it is so important that minority people participate in them so we can develop effective therapies, especially for communities shouldering an increased burden of cancer. Our students can also engage in activities raising awareness and about cancers that have an outsized impact on their communities. They can discuss risk factors. They can also discuss the importance of periodic, regular cancer screenings performed by healthcare providers, so that if this disease strikes, it can be diagnosed in its early stages when its treatment is much, much easier. Bowie State students in the biology program who have taken a cancer biology course have been engaged in some of these activities. They have created educational materials in the form of TikTok videos, short plays, or social media campaigns. And they bring through these instruments accurate information to persons who otherwise would not have access to this information. And all these activities that engage the community can take place in settings such as church gatherings, family reunions, or other social community events. And since the information is coming from people they know and they trust, it is likely to be believed and be well accepted. Now, the students that engage in this sort of activities also gain incredible, invaluable experiences that increase their competitiveness as applicants to advanced degree programs, such as medical school or PhD and master degree programs in biomedical sciences. As they progress through their degrees and they enter their workforce, they are diversifying it. So there is more physicians and scientists that look like you and me. To conclude, there are pervasive health disparities in cancer. However, minority serving institutions of higher education, such as HBCUs, can narrow those disparities. Simply put, our students can engage their communities to raise awareness, and most importantly, to help them transcend the wrongs of the past by building bridges of trust with the physicians and the scientists that are working on new treatments, so that together we can develop therapies that will save the lives of all people, regardless of their race or ethnicity. My parting thoughts to you are simple. Anyone can get cancer. But you do not have to be a physician or have a PhD in biomedical sciences in order to join the fight against this disease. Become informed. Become active. Be aware of your risk factors. Go get screened. And if offered the opportunity to participate in a clinical trial, please consider it. Because hopefully, by doing all of this, in the near future, when someone asks you in an audience to raise your hand if you have lost someone to cancer, there will be far fewer hands in the air. Thank you.